Dr. Robert and Lincoln Tan are a father and son urologist duo who have treated hundreds of patients throughout their professional careers.
Growing up, I had a lot of exposure to my dad's work. I found that although he was often very busy, he seemed to enjoy his work very much. He often talked about his work at the dinner table. One day he brought back the spark plug of an ESWL machine. I asked him, "Dad, what's this for?" He said, "Oh, I use this at work to break stones." So when he wasn't looking, I took this and went to the backyard and actually started breaking rocks in the garden. It was my first encounter with the Dornier ESWL. So subsequently, I went on to do medicine. Before it came time to decide on my final path, I thought, maybe I should try out urology. And I did one posting, and then I discovered that, hey, urology is really fun, and I understood why my father enjoyed urology, and that's how I became a urologist too.
I was very touched that he became a urologist. Even when he was young, he hardly see me, and only at night when I come home, the light shines through his window. So now I'm equally and very happy that he's a urologist working with me in the same practice.
Yes, just recently, I had an elderly lady with a large 1.5 cm kidney stone. She was offered at another hospital ECIRS. Essentially, that means putting a camera up the urine passage, up to the kidney, plus putting a hole through the skin and letting a camera go in through there into the kidney. The patient's son is actually my father's patient, so he brought her to see me for a second opinion. And I thought that we could do this non-invasively with ESWL to break the stone. I wasn't 100% sure that we could break up the stone in one session, but my father thought differently.
So I told Lincoln, don't worry, we'll break this stone in one session. 99% of stone will break with the Dornier machine. And don't tickle the stone, hammer it slowly until the stone fragmented.
So I've just saw the patient today. She's very happy, all the stones are gone and she didn't have to be admitted, she didn't need any general anesthetic.
Since then he's been well and he's been passing out the stone fragments.
She was happy with being taken care of by both of us.